So last month, I had really bad tooth pain. It was so bad, I couldn't even chew on that side of my mouth. Now, this pain developed when I was in the middle of an experiment. And this experiment was me discontinuing any red light therapy treatment for a month. I shrugged off the tooth pain as a coincidence, and fearing the worst, I actually booked a checkup with my dentist. Unfortunately, though, he had a 4-week waiting period. Now, what was interesting is this pain continued to get worse. When I reintroduced my treatments, the pain pretty much disappeared within a few days. But knowing how severe it had been, I decided to continue with my appointment. And so I'm recording this a few days after my recent dentist appointment. I went into this appointment again with no pain at the time, but I told him, look, my tooth was bad. Like I wasn't able to eat on that side. Drinking water scared me. I really thought it was going to require a large filling and, of course, a big chunk of money. Anyway, he gave me a thorough exam. He checked everything. He checked the filling. He did some nerve testing. He even done a bunch of x-rays, and everything came back perfectly normal. I asked him for his explanation. Hey, why was I feeling pain? And he actually had no idea. I told him about the red light therapy treatment and if that could be contributing to it. And he was actually familiar with light therapy and the impact it had on dental health. So he said, yeah, it's probably why I no longer have an issue there. Though I don't want this video to be a deep dive into the science behind red light therapy. In fact, I want to share you some stories. But before I do that, be sure to stick around because at the end of this video, I'll be sharing with you the devices I use and the exact protocol in my red light therapy treatment plan. Okay, so about 2 months ago, I published a video titled Red Light Therapy Benefits Gone, My Crazy Experiences After 4 Weeks Without Red Light Therapy. In this video, I pretty much explained how I had been using red light therapy consistently for many, many years. And then because of a holiday, I actually decided to stop using it for 4 weeks to see what would happen. Now, a few things happened. Firstly, I noticed my overall health and vitality was a bit off, which was a bit unusual because I was on holiday, I wasn't training, I was taking it easy. So usually your body goes the other way. Secondly, I have some high gum points on both sides of my mouth, and I noticed the sensitivity of those high points actually came back. Thirdly, I have some chronic back pain, and my back pain was the worst during that holiday period. Again, it was frustrating because I wasn't training. Instead, I was just relaxing, going to the beach, going for walks. There was nothing strenuous happening. Finally, I developed that tooth pain. So I talked about all of those things in that video, and I pretty much said, hey, look, I stopped red light therapy. Pain and problems have increased. Now, what was interesting is a lot of people freaked out when they saw this video because they pretty much concluded that, hey, red light therapy is just simply masking a problem. And that was a valid point, and in fact, it's something I've spent a lot of time thinking about. Now, upon reflection, there are some comments I want to make about this. Firstly, the back pain and the high gum sensitivity are both chronic issues. I've been told from specialists that pretty much my back pain is due to some serious imbalances and some movement issues, and that's potentially going to take a long time, a lot of work to correct, including not much serious training, which I kind of like doing. The other option is surgery, and I really don't want to get surgery. So it's something that I'm kind of just living with and I adapt to and work around. The gum sensitivity, again, I'm told by a dentist that this is something that can't be fixed. It's something I have to live with. I can either use the chemical-laden sensitive paste or you can get rather intensive surgery. But because red light therapy had been helping with the pain, I just sort of live with it. So with these two scenarios, the red light therapy was helping with that daily management of the pain and the inflammation and the other issues that may come up. I would never expect red light therapy to somehow realign my back and totally fix the mechanical underlying issues. I know that's not going to happen. Likewise with my gums, I know the gum can't regrow and address those high points, which is why I'm getting sensitivity. But I do know when I'm consistently using red light therapy, that pain's gone. And again, I don't have to use those chemicals in my mouth and I don't have to consider like horrible surgery. So with those two examples, the red light therapy is helping, but it's not fixing. But that's because those problems can't be fixed. As for the other things I noticed, so if I got really bad sunburn, usually I'd use red light therapy. I wasn't doing that. I noticed like a day or two later, I was still sore. Whereas typically if I get sunburn, a good session in front of the panels and the next day I'm feeling amazing. That was quite obvious that there was a change. And like I said, I was feeling a little bit off. I don't know what that was. Someone mentioned like withdrawal symptoms from the panels. I don't know. I really don't know. So those are just some reflections on that video because there were quite a lot of comments around that. But now that I've reintroduced red light therapy, I need to talk about what's changed on the other side. Before I do that, I just want to give a shout out. If you're looking for the best product for red light therapy or a little bit about the science or whether it works or not, I know there's a lot of information out there. I spend a lot of time researching, reviewing, comparing products. Now, if you enjoy this content or find it valuable, I really appreciate it if you give me a like and of course hit the subscribe button. So after about 4 or 5 weeks without red light therapy, I fired up my Platinum LED Biomax panels, my 4900s, and did a 5-10 minute session. I'd like to say there was an immediate profound change that day. I don't recall there being anything significant. I would have taken notes if so, but I definitely know within a week or so, I was starting to feel better. Now, what did I notice? Well, the gum sensitivity, like ice cream, cold drinks, even some hot foods. The pain from that had gone back to the old times, which was good. Now, the back pain definitely improved. It's not perfect, and that's because there is another issue going on there. Last year was a brutal year for my training and my lower back. If you followed some of my other videos, you would have seen why. So there is some issues going on there, but I've gone from needing Panadol, paracetamol some nights just to get through the night without pain to stopping all of that, just doing my red light therapy instead. So again, it's not fixing that underlying issue, but it's definitely helping with the pain and the inflammation. But the most interesting thing was that really sore tooth. Okay, so remember at this point, I probably had about 2 or 3 weeks of really bad dental pain. I was literally like counting down the days until I could get to the dentist. I was calling up asking, hey, can you put me on the cancellation list and say in case something came up? But after a few days getting back into my regular therapy treatments, I noticed that pain was getting a little bit less. It was still there, but it was definitely getting less. And that's when I started thinking, you know what? I think this is going to fix it. Though whether it was going to fix it or just mask the pain, as people had been saying, I wasn't too sure. And that's why I was still keen to get into the dentist. And of course, you know how the story finishes. By the time I get to the dentist, the pain was absolutely gone, but I still went in. There was no underlying issue. There was no nerve damage. There was no cracking in the fillings. Everything looked perfectly normal. So what was going on? I don't know. I really don't know. It would have been amazing if I could have got into the dentist when the pain was really bad. And he said, this is the problem. We're going to fix it next month. And then I went and did the 4 weeks red light therapy and then did the follow-up and to get a before and after. That would have been awesome. But unfortunately, I don't have that data. It's definitely something I'm going to keep in mind in the future. I don't think it was all in my head because this pain was pretty bad. And again, I've seen the other impacts, the gum health, the lower back pain, just general vitality, all come back online, all improve since I've resumed my regular red light therapy treatment. Now, one other thing I need to mention is my Oura ring data. You see, every night I sleep with my Oura ring on. It shows a lot of stats, recovery stats, respiration, heart rate variability, all that cool stuff. So we'll go into the readiness screen and then we'll look at resting heart rate. Now I'm going to change it to month. Now, what do you notice? There is a massive drop off in January, and that's when I did my 4 weeks without red light therapy. And it bounced back in February and it's back to sort of baseline around that. And now it's sort of back to baseline around that 48 to 50 beats per minute. But there was definitely something going on in January there. Again, you can see it in the week calendar here where it just trends down. I don't know what was going on there. I don't know what's causing it, but I did find it interesting. The other interesting data point is the body temperature. So if we put this into trend mode, we're in March at the moment. I'm going to come back until around Christmas time. So that's late December there. What you will notice is this is when I stopped my regular treatments. My body temperature dropped all through January and then only started coming up around that end of January mark where I resumed my red light therapy treatments. And then as you can see, it's been trending up since. In fact, if I scroll back, it's pretty much always trending up. There's never really been a big period where it's been low, except for the 4 weeks in January. January the 1st till January the 24th. Now, I'm not too sure what all this means, but I did find it quite interesting. I have a theory that the red light therapy panel is helping with metabolic health and metabolic function. We know that it is boosting ATP and mitochondrial performance. Now, maybe this is all having a bit of an impact on metabolism, hence why my temperature dropped when I wasn't using it, and so did the resting heart rate. Now, there's also one other interesting tidbit that I need to share. Late last year, I put out a review on the OmniLux men's mask. In this review, I said, hey, look, if you want me to do a long-term review, leave a comment and I'll do it. Enough people said that, so I am starting a long-term review with that mask. I started that long-term review with the mask about a week or two after I resumed my regular Biomax treatment sessions, right? Now with this mask, what I'm actually doing is covering half of it so I can hopefully see if there's a difference between left and right. Now I've been using that for say 2 weeks now. And what I've noticed is my gum sensitivity, it's not bad, but it's coming back. It's sensitive again to the point where I'm a little bit nervous around sort of ice cream and stuff. Again, it's not as bad as it was over the summer break, but it's not as good as I'd expect it to be. Now, I put this down to 2 things. Firstly, I've covered off half the mask, so I'm getting no light treatment on that side of the face, but I'm also noticing on this side as well. And I think it's because the irradiance in the mask, the power output, is so low compared to the big, large panels I typically use, that it's not penetrating into the gums, which is, it's a little bit of a bummer because I don't really want pain, but I want to see through this experiment. But that's all I can think of. My back's still feeling good. That other pain down here with the old tooth, that's not a problem, so that's gone. But that high gum point sensitivity is sort of creeping back. What's my takeaway from all of this? Red light therapy does work. The science is there. There's tons of stories online. I could share my other videos where I've talked about the benefits and how it has changed my life. But you really do need the right product, the right device. And this is where I find the panels to be the best. They're putting out a ton more light than the little masks and say the lower powered belts and things like that. Those have a time and a place. For instance, the masks are designed to treat superficial skin issues and bacteria, acne, all that sort of jazz. But if you've got deeper rooted issues, joint pain, wound healing, inflammation, muscle recovery, that's when you need that near infrared light, and that near infrared light at a higher intensity. So if you've watched all this and just want to know exactly what I'm doing on a week by week basis and what products I'm using, I'm going to put a link to how I use red light therapy, and there's a few insights in there in terms of products and devices that you may want to consider. If you do have any questions or comments though, please leave them below. I'd love to hear your feedback on this. You're probably thinking it sounds too good to be true. Again, I'm open for feedback and criticism. I'll talk to you soon. Bye.